my name is Jolene Bostwick. I'm a member of the 2016 CPNP Programming Committee, and it is my pleasure to be here with Dr. Vicki Ellenrod, who is a professor at the University of Michigan College of Pharmacy. And Vicki is one of our highly esteemed speakers that are going to be presenting at the annual meeting this year. And we're here to talk to Vicki about her session and her area of expertise. So we'll dive right in with the first question, Vicki. Can you share a little bit about your background and as well as your current role?
My current role. So I'll start with my background. So I am a pharmacist by training, who then after when I was done with my degree went on for fellowship training and was able to train in a genetics lab and then from there successfully develop a pharmacogenetic research program.
In your current role?
My current role, I actually wear many hats within the University of Michigan. I'm a professor in the College of Pharmacy as well as the Department of Psychiatry and the College of Psychology, as well as currently serving as the Director of Education for the Michigan Institute for Clinical and Health Research, which is funded by our Clinical and Translational Science Award grant.
Excellent. And how did you become interested in the field of pharmacogenomics?
So like I said, when I finished my when I was doing my fellowship, it was at a time when pharmacogenomics was really starting. People didn't really understand where it had its role in therapy, what it really was, and so I was fortunate enough to train in a genetics lab to learn the techniques associated with pharmacogenetics. Because of my pharmacy background and my understanding of drug metabolism as well as pharmacokinetics and pharmacodynamics, as well as pharmacology of the different medications we use, I was able to kind of mesh those two backgrounds to develop a pharmacogenomics research program, first starting with a training award through the National Institutes of Mental Health, and then going on to getting independent investigator support through the R01 mechanism.
Excellent. So in thinking about this session, what do you think is the most common misconception about interpreting the results of pharmacogenetic testing?
I think there's a lot of misconceptions about pharmacogenetic testing. I think the first is that it really doesn't make a difference. And I think we need to remind ourselves that every patient makes a difference and how every patient responds to the medication matters to them in particular. And so even if someone has a little reduction in the amount that they genetically show in terms of metabolizing the medications, it could make a huge impact for that patient. And so looking at this information and seeing how it may change the sort of recommendations that you're making. I also think another misconception is that there's bias in all of these testings, or that the tests that we use to determine the different DNA sequence is flawed or it's going to vary between different companies. I think that science is pretty rock solid and has been around for a while, but how we interpret those results, I think, is where a lot of variability lies. And so I think as pharmacists, it's our duty to understand what these genetic variants may mean to our patients, and specifically for that patient that we're seeing in front of us, what it may mean to their current therapy that they're receiving.
And with that in mind, how do you feel the pharmacist's role is evolving with regard to the increased availability of these tests? I
think these tests are becoming more and more available, not necessarily through the healthcare system. We have a lot of online testing like 23andMe, which we're going to talk about, where patients are getting the testing done themselves. And I think our role is really critical to the interpretation of the results. Getting these tests back without any sort of context associated is very confusing. Patients don't understand it, prescribers don't understand it. And so our role as the medication experts then really is to help the interpretation of what it may mean. We have some genetic variants out there that don't really cause a whole lot of change in terms of pharmacokinetics or dynamics, and understanding when it's a specific variant that's going to cause a clinically significant change. And then also understanding the resources that are out there available to us for the interpretation of this, and helping to educate not only the patients, as well as the healthcare providers using this information. I tend to partner a lot with genetic counselors. They're really great at talking to patients about what genetic risks are. But when they're asked that question of, what do I do next? They don't know the drugs. And so that's kind of where I step in and can make some recommendations in terms of what should be done next.
What can the audience expect to gain from your session?
The audience can expect to gain very hands-on sort of looking for interpreting this test. We're going to show you a profile of a patient that comes to you, and it's going to be your responsibility to come up with what you're going to tell that patient and how you're going to use that information.
And it's so important because most of us experience that day to day in our clinical practice, so I think it's a very clinically relevant form and way to look at this problem.
You're going to have to actually physically use during the session some of the resources that we're going to be talking about.
What are some of those specific resources that participants can look into before the session if they're interested in learning more about this topic?
Probably the greatest resource that patients can look up is the Pharmacogenomics Research Network, as well as PharmGKB, which is a vast resource related to pharmacogenomics. One of their partners are the CPNP, which is the clinical implementation of Pharmacogenomics Consortium, and the guidelines that experts have come up with in terms of the interpretation of a lot of these tests.
Excellent. So we'll be talking more about those resources in a session that precedes Vicki's content, but also in Vicki's session.
Yep.
And her content, or the title of her session is Debating Genetic Testing, a closer look at clinical application. We look forward to seeing you in Colorado Springs in 2016.